Hey everyone, welcome back to part 2 for chapter 6 lecture. And so to start this off, how can identification and treatment of multiple risk factors be used to address the burden of non-communicable disease? Well, we know how important risk factors are to public health. For example, factors like high cholesterol levels or numerous sexual partners help us identify what groups are at high risk for certain diseases. Many public health evidence-based recommendations focus on addressing these risky behaviors/factors and targeting high-risk groups with appropriate interventions. So now what is a multiple risk factor reduction? Multiple risk factor reduction, or MRFR, is an intervention strategy aimed at reducing multiple risk factors simultaneously. As the name suggests, it focuses on targeting more than one factor at once, especially when these factors cluster together in definable groups of people. MRFR is particularly useful when the combined effect of two or more risk factors increase the risks exponentially, more than the individual impact of each factor. So for example, multiple sexual partners and anal sex both increase the risk of contracting STIs. Anal sex specifically is risky because the lining of the anus is thin and can be easily damaged, which makes it more vulnerable to infection. So if someone engages in both these practices, the risk is much higher. Then for the next example is asbestos exposure and cigarette smoking. These both significantly increase the risk of lung cancer. If the relative risk of smoking is 10 and the relative risk of asbestos exposure is 5, then the combined risk of both is 50. However, if the person stops smoking, the relative risk declines from a 50-fold to a 5-fold increase. And MRFR works best when multiple risk factors are clearly present in the same individual, allowing for more effective targeting of those factors to significantly reduce overall risk. All right, so now today there's a wide range of interventions available to treat various diseases. However, with the rapid increase in treatment options, it's crucial to identify which interventions provide the greatest benefits at the lowest costs, or basically biggest bang for your buck, essentially. And then this brings us to the concept of cost effectiveness, which is where it combines issues of benefits and harms with issues of financial costs. And the process starts by considering the net benefits of an intervention, so benefits minus harms, to determine its net effectiveness. And once we determine the net effectiveness, we factor in the financial cost to see if the intervention is truly worthwhile. We also have incremental cost effectiveness, which compares a new intervention to the current or standard intervention. And it usually asks the question, is the additional benefit of this new intervention worth the additional cost? It also evaluates whether a small loss of effectiveness in the new intervention could still be justified by considerable savings in cost. As we're talking about cost-effective interventions, there are 3 ways we can essentially mean an intervention being cost-effective. So the first meaning can be reducing costs while increasing net benefit. And this first meaning is quite rare, as most interventions require an increase in cost to achieve better effectiveness. The second meaning is increasing the cost, but it's still worth the investment. Because in most cases, to increase effectiveness, we need to increase the costs. When we determine that we can afford the added cost, these interventions are considered cost-effective, even though the cost went up. Now, for example, many preventative and standard treatment interventions might increase costs, but are still considered cost-effective because of the greater health benefits they provide. So some economists argue that costs should not be limited to just the direct cost of the intervention or future medical care, and instead we should also factor in non-health related expenses, such as transportation costs, loss of income, and other non-medical expenses that can affect an individual's well-being and overall cost effectiveness of an intervention. And since determining cost effectiveness has become so complex over time, many experts use a measurement called a quality adjusted life years, quality is short, to assess the value of an intervention. So a quality adjusted life years, QALYs, we call them for short, take into account not just the number of lives saved, but also the quality of those lives and the number of years of life lived in full health. So one QALY is equal to 1 year of life at full health. And economists typically place a financial value on QALYs, often valuing one QALY at $50,000. All right, and now what I have here is figure 6.1. which is a tool that helps us categorize the interventions by analyzing the cost and net effectiveness. And this allows us to visually assess where different interventions fall in terms of the cost effectiveness. So, of course, the ideal intervention, this is located in the lower right quadrant, where the costs decrease and effectiveness increases. However, interventions in this ideal quadrant are often rare since it's challenging to reduce the cost while simultaneously increasing effectiveness. Then you can see in the top right quadrant, there's an increased cost, but there's still an increased effectiveness. So that's why that one's still considered the cost-effective strategy. Now, if you go to the top left quadrant, we see there's increased cost, but then decreased effectiveness. So right there, it's just a net zero gain, or even actually in this case, it's worse. So therefore, that one's not cost-effective. Now, the bottom left one, we have a decreased cost, but then decreased effectiveness. Now, the thing is though, with this one, it may be cost effective if the decreased costs are worth the small decrease in the effectiveness. So that's one thing you have to keep in mind. Right now for a new topic, can genetic testing help predict disease and disease outcomes and allow more personalized medicine? In the early years of the 21st century, we have seen an explosion in our understanding of human genetics, and genetic testing has become more accessible and affordable. This rapid advancement in science and technology has led to more interest in using genetic information to predict disease outcomes and guide personalized medicine. So first off, we have something called predictive genetic testing, which looks for gene mutations that may increase a person's risk of developing a particular disease. For example, the BRCA mutation is linked to a higher risk of breast and ovarian cancer. If a woman with breast cancer tests positive for the mutation, her family members can determine if they carry this gene as well via that test. Now, for women who carry the BRCA mutation, the risk of developing breast cancer is as high as 80% over their lifetime, along with the increased risk of ovarian cancer. However, predictive testing does have its limitations. In many cases, just because someone carries a gene mutation associated with a disease doesn't guarantee they'll develop it. And this is known as incomplete penetrance, where the gene may slightly increase the risk, but not necessarily cause the disease. At present, predictive genetic testing is mainly used to predict the development of symptomatic disease. Now, next up, we have pharmacogenetics testing, which involves testing how a person's genetic makeup affects their response to certain medications. And this can help determine which drugs are most likely to be effective for them, whether they need dosage adjustments, whether they might experience side effects, or allergic reactions to a drug. For instance, when it comes to, say, cancer treatments, it's common practice to now perform genetic testing on the tumor tissue. And this helps predict how the cancer might behave, and more importantly, which treatment options are most likely to be effective for that person. And our third one, which actually is kind of a big one, is the reproductive genetic testing. And it's a form of testing that looks to identify individuals who have an increased risk of passing on genetic diseases to their children. Carrier tests are commonly used to determine if someone is heterozygous, with a carrier, for a mutated gene, meaning they have one copy of a normal gene and one copy of a mutated gene. So for many genetic diseases, an individual needs to inherit two copies of the mutated gene, one from each parent, for the disease to manifest. Carriers usually don't show symptoms, but can pass on the mutated gene to their children. And these tests are increasingly a part of prenatal care. For example, many health providers recommend that pregnant women undergo blood tests that check for chromosomal disorders. Now, this does lead into some ethical, legal, and social issues as well. Now, because we have all the potential benefits of genetic testing, there are still important ethical and social questions to consider. Should we identify the disease when little can be done to prevent them or cure them? Should genetic risk information be shared among family members? How do we prevent the stigma or discrimination based on genetic information? How to ensure the benefits of genetic testing are not restricted to those with expensive coverage? Those are all questions that we would have to keep in mind should we go down this route. Okay, so now how can we combine healthcare and public health interventions to increase that benefit? So many non-communicable diseases, or NCDs, and other significant health problems can be best addressed through collaboration between healthcare systems and public health initiatives. By combining these two approaches, we can create more comprehensive solutions to address pressing issues like opioid overdoses, suicide, and alcohol abuse. Starting off with opioid overdoses. Since the 1990s, the introduction of many prescription opioid drugs has led to increased addiction and long-term health consequences. Opioid overdoses have increased fivefold since the year 2000, with deaths rising from 20,000 to 100,000 per year. And this increase in opioid-related deaths is roughly on par with the combined number of motor vehicle accidents, suicides, and homicides. A major driver of this rise in overdoses is addiction stemming from prescription opioid use. Many people who start using opioids for pain management end up becoming addicted, leading to long-term negative health impacts. Hence the crackdown in administering opioids at the lowest possible effective dose. Next up, for suicide prevention. Preventing suicide often requires combining clinical medicine, such as personalized care, with public health strategies that address population level risks. In the US, approximately 50,000 people die by suicide every year, and there are about 1 million attempts annually. The causes of suicide vary widely, ranging from impulsive teenagers to postpartum women to seniors with chronic health conditions. Various risk factors for suicide have been identified, such as the presence of veteran due to trauma and stress, depressed individuals, especially those emerging from depression, and people who have previously attempted suicide as well. We do see that women are more likely to attempt suicide, but men are more likely to die from suicide due to the methods used. Now, one of the most effective strategies for preventing suicide is simply asking individuals about their current or past suicidal thoughts or plans. And this has shown to significantly reduce the risk. One approach developed is what we call the QPR method: question, persuade, and refer. Additionally, the 988 helpline has been launched as a national suicide prevention and mental health crisis service, and is an excellent resource for individuals in need of immediate assistance. Now, next topic of alcohol abuse. It has been a long-standing health issue that has developed over time, with different approaches coming into play, especially after Prohibition failed in the early 20th century. Now, post-World War II, the efforts shifted from banning alcohol to addressing or educating people of its harmful consequences. Initially, public health efforts focused on the consequences of alcohol use, such as liver disease, fetal alcohol syndrome, motor vehicle injuries. Back then wasn't a huge concern because cars are still relatively new. And then alcohol-related violence, which can be either intentional or unintentional, and the spread of diseases linked to promiscuous behavior. Now, one of the key changes after Prohibition was the shift in policy, because rather than outright outlawing alcohol, policymakers focused on taxation and restrictions on advertising, which helped curb excessive drinking. Higher taxes on hard liquor, for example, led to decreased sales and an increase in beer and wine consumption, which were perceived as less harmful. Collaborative public health efforts also emerged, such as a cooperation between transportation authorities and police departments, for instance, an increase in DUI checkpoints. And for individuals struggling with alcohol dependency, efforts like Alcoholics Anonymous, or AA, and other peer support groups have played a vital role in recovery. Additionally, medical interventions now exist to help individuals with alcohol withdrawal or detoxification. Also, many people suffering from anxiety, depression, or ADHD are advised not to drink alcohol while on pharmaceuticals for the conditions, which helps reduce alcohol consumption among these groups. Now, today, a key risk factor for alcohol abuse is binge drinking, particularly among college-aged individuals. And as a result, intervention efforts are increasingly focusing on this high-risk group. All right, so finally, how can we utilize research when highly effective interventions do not exist? Well, research has already led to highly effective interventions for many non-communicable diseases like cancer, heart disease, migraines, and arthritis. But Alzheimer's dementia remains a key example where ongoing research persists, and this research continues to play a crucial role in health needs. Alzheimer's disease in particular is one of the fastest growing causes of disability and death, especially as the global population ages. This condition primarily affects the quality of life as it progressively damages memory, particularly short-term memory. And this can have significant emotional and social impact on both the individuals and their family members. Now, research has shown that increased physical activity and reduced cardiovascular risk can moderately affect Alzheimer's in a positive way. This is why public health campaigns emphasize the importance of staying physically active and managing risk factors like high blood pressure, cholesterol, and smoking. In addition to physical activity, nutrition also plays a key role. Research suggests that certain diets or nutrients may slow cognitive decline or improve brain function, though more research is needed to identify the most effective approaches. As a result, public health efforts push many of these existing interventions that enhance the function of individuals, but also stresses the importance for continued research. And that is all for this lecture. Thank you all for your time.